right in here.
I was having headaches at least 2 to 3 times a month, and they were, to the point that I either had to go home from work or I didn't even go into work.
All right, Sonia, we're all set up. I'm gonna start taking some pictures, and then we'll go ahead and start numbing up the neck here, okay?
They could be migraines. He said they could be migraines, but he said they originate mostly from the back of the neck, and it's the occipital nerve pressure that was causing the occipital nerve headache that I was having.
A lot of times we'll do this in the upper neck. Those patients have a lot of neck pain, chronic headaches, and usually posterior headaches, and those are often debilitating. It just really keeps them from being able to focus, keeps them from sleeping well, keeps them from doing the things they regularly want to do.
I would say I've had headaches of some sort since my teenage years, but probably only for the last 5 years have they been really bad.
So for the radiofrequency ablation, we have already determined what our target is with the diagnostic blocks. We know what levels we're going to go. So for the lumbar spine, we'll guide some special tip needles into the spine and use the X-ray guidance to basically parallel park those needles right along the nerve of interest.
Everything looks good. We're in position. I'm going to start giving you some local anesthetic right on those spots there.
And then there's a special probe that goes inside this needle, and we create a TENS unit, and we will test it by applying an amount of electrical stimulation. That's going to cause activation of the nerve. We basically short circuit the nerve, make sure that that's what we want, and make sure we're not getting anything that we don't want in the spine.
He is very thorough in his explanations. And what I've liked about all of the physicians at Methodist is you can message them through the portal and they will respond back to you.
If everything checks out and it's in the right position, we're not getting any collateral activation that we don't want, then we apply the radio frequency, which is a rapidly alternating current. And that basically, very similar to microwave technology.
I think we're good there. Okay, we're gonna turn that on. You're gonna feel a little heat, pressure, or spasm here, okay? We'll let that heat for 90 seconds here. You'll see that that's advancing to a temperature of 80 degrees Celsius. Then it'll start the countdown. It'll create that lesion for 90 seconds. It's gonna create an oval or football-shaped lesion right off the last centimeter of that needle.
Pretty straightforward, 15 to 30-minute procedure in most circumstances. I tell patients they'll be sore.
Okay, that's it. I'll remove those probes.
I was surprised how quick it was. I feel like the prep time, like the pre-op time, I was there longer than I was in the procedure.
It's an outpatient procedure. Patients go home same day. They're able to be active that day. Usually tell them to take it easy after the first day. I give them no specific restrictions. They're able to do whatever activities they want to do. The radiofrequency ablation has some of the best evidence for consistent relief, and it's a very focused treatment for a very specific problem.
To have the adult portion of my life all be surrounded by headaches and that you have to, rearrange your day and your plan, I would think that would be life-changing to not have so many headaches. And I have yet to wake up with a headache.
I've seen a patient have a new outlook on life and be really satisfied with that procedure, and just give them an opportunity to do what they want to do and make the most of their life.